Hi there. My name is Madison Lindeman. I am currently a social work major with plans to earn my master's degree in social work with the hopes of eventually obtaining a doctoral degree in psychology. So, since we all know our observation hours got cut short due to the current global pandemic, so we were given an alternative option to make a video discussing the impact that COVID-19 has on our desired field of work. So today I'm here to talk about how social workers have been affected by the pandemic. So upon doing some research, according to the source socialworkers.org, the National Association of Social Workers has meticulously been working on multiple fronts to prevent the spread of COVID-19 and have ensured access to services such as teletherapy. For those who don't know what teletherapy is, it's actually a way to provide therapy through a live video connection over the internet. So people who suffer from mental or mood disorders like anxiety, bipolar disorder, depression, whatever, can still have that interaction with a social worker, but it has to be through the screen. This is achievable through many platforms, any webcam service. You can easily gain access to it that way. So thinking about children and their families right now is actually a critical time for at-risk children, resulting in many families spending far more time cooped up together at home than they are usually accustomed to. And due to the number of layoffs and legitimate job losses, that heightens the level of stress in homes where parents suffer from substance abuse, mental health problems, or unfortunately have a history of domestic violence. Another study was, I think it was according to The Guardian, the coronavirus has left children and family specialists without any national rules or advice on how to adapt their approach to ensure even minimal safeguards when contact is limited. So social workers have been immensely deprived of interaction with children, adults who suffer from mental illness. Actually, there was a recent report of a 10% increase in calls and in text messages to a child abuse hotline called Child Held. And it was through the first 18 days of March, which was apparently a significant increase compared to February. For good reason, families, so yeah, one of the reasons why families are, social workers can't get any interaction is because families alone don't want social workers to visit due to the fear of spreading the infection. So, not only are they limited to that, it's very scary for social workers right now. If anybody knows, the responsibility and the role of a social worker is not easy. It's a very difficult and it takes a lot of strength, and I'm sure this entire process has just been debilitating to social workers and how they've been thinking. During all of this, we can't alone focus on the social workers. A huge focus needs to be on the children who, don't have good support systems. They don't have a good family life. They live in a very toxic environment. We have no idea what the numbers are going to look like after all of this ends. I mean, just the thought of how many children and how many teens possibly have been negatively affected or have gone through any type of abuse is just it's I can't even think of a word. It's super super discouraging to even think about. Um, so putting all of this together, the biggest factor here is that social workers are, they're unable to do their job. I mean, it's the job requires in-person interaction. It requires home visits. It requires assessments, and they're not able to do that. And you can only do so much online through a video chat, and a lot of the times these video chats are monitored. There's, the family is in the background, or, there's just one kind of factor that plays. So, all we can do is continue to stay strong as a community and pray for all types of families who, have that abuse or substance abuse or anything like that. We need to continue to keep them in our prayers, and that's unfortunately, all we can do right now. Social workers can continue to give their support and, listen to people and try to talk to people through the ways that they've already been doing so. But, in this moment, that there's really nothing else we can do. We have to continue to social distance. And the fact of the matter is, that's it. So we just got to hang in there and stay strong.